Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present a lecture on Japanese encephalitis, which is also known as Japanese B encephalitis and arbovirus B. The Japanese encephalitis is a mosquito-borne viral infection of horses, pigs, and humans. It is also referred to as Japanese B encephalitis, arbovirus B, and mosquito-borne encephalitis virus. In today's lecture, we will cover the information regarding the organism that causes Japanese encephalitis and the epidemiology of the disease. We will also talk about the economic impact the disease has had in the past and could have in the future. Additionally, we will talk about how it is transmitted, the species it affects, the clinical signs of the necropsy findings, as well as the diagnosis and treatment of the disease. Finally, we'll address the prevention and control measures of the disease as well as the actions to take if the Japanese encephalitis is suspected. The Japanese encephalitis virus belongs to the genus Flavivirus in the family Flaviviridae, related to St. Louis encephalitis virus or Murray Valley virus and West Nile virus. The name of the family is derived from the Latin flavus, meaning yellow, which refers to the yellow fever virus, also a member of this family. The Japanese encephalitis virus is an enveloped single-stranded RNA virus. Currently, the morphology of this virus is not well defined. The first historic mention of the Japanese encephalitis occurred during the summer encephalitis outbreaks in the late 1870s. The next documented epidemic in Japan occurred in 1924 with the 6,125 human cases, resulting in 3,797 human deaths or 62% case fatality rate. The Japanese encephalitis is a zoonotic disease that affects humans and several species of animals. It is transmitted by mosquitoes. The most important vectors are Culex species. There have been limited studies done on the snakes and frogs. Their importance at this point is unclear. The several additional species can become infected with the Japanese encephalitis but are incidental hosts since they do not achieve viremia sufficient enough to cycle the virus in nature. The incidental host species includes horses, donkeys, cattle, water buffalo, sheep, dogs, chicken, and ducks. Humans are also incidental hosts. The Japanese encephalitis in animals is most commonly seen in late summer to early fall. The incubation period in horses with the Japanese encephalitis disease is 8 to 10 days. Most infections are subclinical. Affected horses show fever, impaired locomotion, stupor, or teeth grinding. Blindness, coma, and death are also possible, but mortality is really low. The incubation period in swine have not been clearly established, but it is known that the earlier the exposure occurs in pregnancy, the more harmful the sequelae of the fetuses are. The swines that are infected with Japanese encephalitis commonly show few clinical signs except those associated with pregnancy. Pigs infected with Japanese encephalitis will give birth to the litters of the stillborn or mummified fetuses. Experimentally, boars infected with the Japanese encephalitis have shown swollen testicles and decreased fertility. The clinical diagnosis of Japanese encephalitis should be suspected in horses demonstrating the fever and clinical signs of central nervous system's disease. The definitive diagnosis of Japanese encephalitis in animals is by the virus isolation, samples of the blood, cerebral spinal fluid in horses, spinal cord, and portions of the brain that can be used for this process. The brain should be submitted as one half fixed in 10% buffered formalin solutions and on one half unfixed. The Japanese encephalitis diagnosis is or can be tentatively diagnosed by the demonstration of a rise in titer by the neutralization, hemagglutination inhibition, immunofluorescence, complement fixation, and ELISA tests. There is no effective treatment of Japanese encephalitis, only the supportive care is recommended. The Japanese encephalitis has a significant public health impact. The swine and birds can serve as a reservoirs for, as well as amplifiers of the virus. This contributes to the spread of the disease. Although the Japanese encephalitis is not currently found in the United States of America, the transmitting vectors are the additionally importation of the infected amplifying swine is always possible. Rapid identification and the diagnosis will be important for protecting the public and our livestock from this disease. The biosafety level 3 precautions and practices are recommended for investigators working with this virus. Areas and equipment that have been potentially contaminated with Japanese encephalitis infected tissues or blood can be disinfected with chemical agents such as 70% ethanol, 2% glutaraldehyde, or 3 to 8% formaldehyde. Additionally, 1% sodium hypochlorite or bleach, iodine, phenol, iodophores, and organic solvents or detergents may be used. Physical deactivation occurs in 30 minutes at 133 degrees Fahrenheit. The virus is also sensitive to ultraviolet and gamma radiations. However, the virus can survive for long periods in mosquito eggs. The prevention measures are very important for minimizing the Japanese encephalitis infection. The vector controls should include the elimination of potential mosquito breeding areas such as standing or pooled water around the homes and barns. Additionally, the adult and larvicidal programs should be implemented to reduce the mosquito numbers. This may have limited overall effect due to the high cost of retreating areas and resistance of the mosquitoes over the time. Equine and swine in affected areas should be vaccinated. For humans in endemic areas, the vaccinations should be implemented as well as the personal protective measures. Well, with this, we are going to end our today's lecture. Thank you so much.